Your sleep quality is affected by multiple factors. It isn't just how dark and quiet your room is, or what kind of music you listen to before you hit the hay. It's about how you lay your body down, too. So, is there such thing as the best sleep position? Well, according to science, the answer is sleeping on your side. In many ways, side sleepers have it better than others with different sleep positions. However, the benefits of side sleep actually depend on which side you prefer. Watch this video to find out how side sleeping benefits your health. Sleeping on your right side allows your spine to remain in a neutral and natural position, while sleeping on your left is recommended if you're pregnant, snore, or struggle with health conditions such as obstructive sleep apnea. This sleep position is beneficial for snoring and OSA because it helps open up your crowded oropharynx. Side sleeping is recommended if you have carpal tunnel syndrome because it protects your wrist from the pressure of your body during sleep. It also elongates your spine and helps alleviate neck and back pain. A recent study shows that the benefits of side sleeping go beyond the expected and may boost your brain health. A study by Stony Brook University in New York and published in the Journal of Neuroscience investigated how body posture during sleep affects brain waste removal in mice. The results suggest that sleeping on your side helps the brain's lymphatic system clear waste more effectively than sleeping on your back or stomach. In order to understand this, we need to explain what the brain's lymphatic system is and how our body's posture affects it. The lymphatic system consists of a brain-wide pathway that facilitates the exchange of spinal fluid with interstitial fluid and has a role in clearing interstitial waste from the brain parenchyma. When this waste isn't cleared properly, we become more prone to neurodegenerative diseases such as Alzheimer's, Parkinson's, and dementia. The interstitial waste from the brain parenchyma moves in the paravenous pathways and ultimately gets cleared out via the cervical lymphatic vessels. As you know by now, our brain is the most active during sleep, and this is the time when the process of brain waste removal occurs. Side sleeping position elongates the spine and allows for faster waste clearance. Other sleep positions may slow down this process and result in brain waste retention. Therefore, by improving the functioning of the brain's lymphatic system, we can reduce the risk of neurodegenerative diseases such as Alzheimer's, Parkinson's, and dementia. It's important to mention that side sleeping also comes with some downsides, such as unwanted skin aging. Studies show that constantly placing the side of your face on your pillow will cause wrinkles and even lead to saggy breasts. You're also more likely to disrupt circulation in your arm because of the pressure of your body and wake up with an uncomfortable, tingling pins and needles feeling, also known as paresthesia. Side sleepers typically toss and turn in sleep more often than back sleepers, which may lead to less restful sleep. So, which side is better, left or right? Well, as mentioned, sleeping on the left side or the right side has its advantages and disadvantages. Left side sleeping is recommended for acid reflux. Studies show that acid reflux is worse for people that lie on their right side. Pregnant women are advised to sleep on their left side to help circulation and blood flow to the placenta. Expecting mothers, especially those in their 6th month of pregnancy, should avoid sleeping on their backs, as this may cause the heavy uterus to press on major blood vessels such as the inferior vena cava, which has a role to return blood to the heart, which could lead to a drop in blood pressure. Digestion. Studies confirm that left side sleeping helps with digestion. Your stomach and your pancreas' natural position is on your left side. This position allows both organs to make sure your body keeps creating stomach juices and pancreatic enzymes that will help the process of digestion. Sleep-related breathing disorders. People who snore or have obstructive sleep apnea are encouraged to sleep on their left side in order to open up the crowded oropharynx. Vagus nerve arrhythmias. The vagus nerve connects the heart, brain, and the gut. And due to this unique connection, it may be one of the essential causes of arrhythmia. When the vagus nerve is stimulated, parasympathetic activity gets increased, which is the opposite of sympathetic stimulation, also known as the fight or flight response. So, to quiet your vagus nerve at night, studies suggest you want to try sleeping on your left side. Bradycardia. If you have a slow heart rate at night, sleeping on your left side could stimulate your sympathetic response and increase your heart rate. However, left side sleeping may put a strain on your internal organs like the pancreas, kidney, and spleen, along with the heart. Sleeping on your left, the internal organs in the thorax can shift and the lungs may weigh heavily on the heart. This increased pressure may impact the heart's function and potentially worsen the heart strain in heart failure. The heart may respond to this increased pressure by activating the kidneys, increasing urination at night. Right side sleeping is especially recommended for heart health. Some scientists think that age-related preference for right side sleeping is an instinctive protective response for the heart, and studies show that people with heart failure tend to avoid sleeping on their left side. Based on the science, there are 4 major reasons why you may consider sleeping on your right side. Shortness of breath. Heart patients breathe better when sleeping on their right side. Heart patients intuitively sleep on their right side. Now, the reason for this isn't entirely clear, but it's probably connected with a better venous return and lower pressures within the heart and the lungs. Optimum cardiac output. Now, cardiac output may be better for the right side sleepers for the same reasons as above. As gravity pulls the heart towards the center of the chest, it may help optimize cardiac performance. Alleviate palpitations. Palpitations can be described as the sensation of your heart not beating correctly. When sleeping on your right side, the heart is in the center of your chest, which may alleviate some palpitations. In contrast, when you sleep on your left side, the heart is pulled to the chest wall, and you may feel every irregular heartbeat. Patients with arterial fibrillation often report they experience fewer arrhythmias when sleeping on their right side. However, there is still no research that can confirm this. Lower heart rate and less sympathetic nervous activity. The sympathetic nervous system is the body's fight or flight response, and it often makes our heart rate and blood pressure go up. Sympathetic nervous system stimulation makes patients' heart failure, chest pain, or arrhythmias worse. Right side sleeping is not recommended for heartburn. Several studies have found that sleeping on your right side aggravates heartburn, while sleeping on your left tends to calm it. The reason for this is not entirely clear, but one hypothesis holds that right side sleeping relaxes the lower esophageal sphincter between the stomach and the esophagus. Patients with pulmonary conditions. With gravity shifting your internal organs to the right, the heart will shift the mediastinum towards the right lung. This will reduce the volume of the lung, and this may be important in certain pulmonary conditions. Left side sleeping also constricts the rib cage and causes the lungs to strain for oxygen. If you're an overall healthy person, it's healthier to sleep on your right side and avoid putting unnecessary strain on major internal organs. To minimize the disadvantage of sleeping on your side, it's important to get a good pillow and a good mattress. The ideal models are the ones that support the natural alignment of your body. When you're lying on your back, your body is properly aligned. When an imaginary horizontal line goes through your ear, through the rest of your body, it is completely parallel. When lying on your side, the horizontal line that runs through your nose should be directly in line with the rest of your body. Once you have a good pillow and a good mattress, sleeping with some extra pillows may enhance the benefits of side sleeping. How to sleep with 3 pillows. The first pillow goes underneath your head to ensure it doesn't tilt down. Next, put the second pillow under your waist so your stomach doesn't curve down. And the third and final pillow will go between your legs to ensure your spine's natural and neutral position during the entire night. So, why is this important? Well, as a side sleeper, apart from keeping your spine properly aligned, you must also keep the right and left side of your body as symmetrical as possible. For example, crossing your left upper leg over your right lower leg is not recommended, as it would cause the left upper knee to drop and the left hip to be rolled forward, causing your lower spine to twist, which may result in back pain. Instead, keep the legs bent at the knee, one on top of the other so the lower leg can support the upper leg. Putting a pillow between your knees will recenter your body, and hugging a pillow will help support your upper arm and leg. If you have large hips and there's a space between your waist and the bed when you lie down, put a rolled towel underneath to prevent your body from slumping down. Side sleeping is one of the most popular sleep positions worldwide. However, if you prefer to snooze differently, you shouldn't force yourself to sleep on your side. The same goes if you prefer to sleep on the left side over the right, and vice versa. Sleeping is a personal experience, and you will benefit the most when you sleep in a position that you feel most comfortable. I hope you got incredible value from this video. If you did, hit the like button, make sure you subscribe, and hit that little bell to get notified every time we get a new video out there. Have an incredible day.